gotten stuck on one thing. Other thing, I've got a pending lawsuit about the fact that the state announced that it's going to stop doing long-term care for psychogeriatric patients, people in their 60s to 80s who are inappropriate to a nursing home. And in case you can't imagine what that is, that's people who are sexually inappropriate or assaultive or scream all the time. And a nursing home can't manage that kind of person. And, and the theory of our mental health leadership was, we'll just shut down this service and those people will spend a month in acute care, and then they'll go to a different nursing home where they'll fail, and then they're back to acute care, then a different nursing home. It's kind of a prescription for how to kill somebody.
You're talking about the Verks building?
The Verks building is the building that housed, that they are shutting down. 65-bed unit. I got an injunction. There are now 9 people in it, and my lawsuit is still pending. And I'll have to say, in the proposed budget for this year, there's $20 million for the rehab of a couple of units that were nursing care type units. But they're you know, for that money, they plan to take care of a new forensic unit, new place for a women's forensic unit, psychogeriatric. It's kind of endless. And I don't see how they can actually. They need to provide me with some details. And the biggest thing is, as the boomers grow into their elder years, they need to to do a survey to project how many beds they're going to need to solve the problem of people who can't make it in nursing homes. And that again is not rocket science, and it's not a big. I mean, right now the number is under 60 people, and as my generation ages, it'll go to 120.
Right.
But you need to plan for that. You don't just exploit acute care and bouncing people from one nursing home to the next. So those are big things.
Okay. Now you mentioned before we came in, you were talking about Rhodey Healthcare and
oh
some
yeah,
of the
other big things.
Yeah.
Although I have to say this, you know, being basically a law office, I mean, this gets to social policy. You want me to go there?
Sure.
All right. Well, these new developments in the world of social service policy are all based on smart people who are about 30,000 feet above the system, who don't recognize differences, because from 30,000 feet that all looks the same, and so to them it looks like poor and disabled people, you know. So let's put them in a bag and let's resort the decks so we can save money, which makes a lot of sense from 30,000 feet. But once you put it in place, there's a lot of issues, and I think one of the issues is we have in place a national model of community mental health care, and it seems to me that Brody Partners, replacing Medicaid, and global Medicaid waiver, replacing Medicaid, could easily bankrupt the mental health centers, and so we'll decline from where we were in. You know, '88 was the best, and now it's 2008, and 2010, and it's in great decline. And so why don't we just kill it, so that mentally ill people can just be treated like every other poor person, since they're all the equivalent of each other. And the whole idea of saving money over poor people is a joke. And while we're doing it, we're still making all these moral judgments. If you're a bad poor person, then you get to be a scapegoat on top of that.
And we pay a lot of money for the beds.
Yeah, and we do. We pay a lot of money. We pay a lot of money for the. It doesn't work. I mean, the global Medicaid waiver was proposed first as a $77 million savings in the budget, of which not one penny was saved. And I think an objective observer, such as myself, could tell right away that this was not going to save $67 million, and that was 3 years ago. Yeah. And now we're 3 years into it, and it hasn't saved any money, and it has disorganized the entire system of care that works fine, and it's taken away the authority of the Department of Mental Health. And did I mention that part of this great idea was to lose the model of independent government, cabinet level agencies for the mission of mentally ill people and the mission of children and the mission of others, to diminish them from cabinet level jobs to where they now report to a secretariat, which is exactly the model of 1952. And our mental health system grew from the 70s because we actually did separate out these responsibilities and put them at the table, and now it's gone. And it's presented to us as a new idea.
Regurgitating an old idea.
Yeah, I'm a little unhappy. Yeah, it's another set of salaries of people, by the way, who have no institutional memory of what they're doing. They're, you know, it's like they're smart, but they really read the story yesterday. you know, and so what do you do with the value of actually knowing what's going on? It's gone, it's lost, which gets us to the next level of conversation.
Right.
I'll let you ask another question.
Well, when you're thinking about the next level of conversation, what does that bring to mind, Reed?
Oh Lord, oh Lord. I mean, first I have to say, I really, really wish we could talk about restoration. I mean, we had a great mental health system. We had a system where you need one phone number to make a phone call, and I'm telling you, there are Phoenix, Arizona. There's 26 competing not-for-profits in that one city. 26 phone numbers. That's an invitation to turf war. You know?
Right. Right.
Anybody but me. It's, and you know, and we can't do. We're not Phoenix. People homeless in our state are going to freeze to death.
Right. In Phoenix, they'll die in the desert.
Right.
Yeah.
And it's just so restoration. Just remember the responsibilities that we took on as a part of deinstitutionalization. Those responsibilities are still very clear in the law. But the bureaucrats, they don't even. I mean, the new bureaucrats, they're unaware that there are legal boundaries on what they might or might not do. It's not even on the agenda. So it's for lawyers like me to finally file lawsuits when their decisions screw things up. So restoration.
Define that for me in terms of when you talk about someone being restored or a system being restored. How do you define that?
I just think that we deserve a lot of credit. The state of Rhode Island deserves a lot of credit for creating a globally funded, unified system for mental health care, and we should be creating a globally funded, unified system for children's care, for child welfare as well.
Well, there should be continuity between from a child going into the adult system.
And in fact, there's a good question about whether when you tweak the restore the mental health system to where it was and tweak it, you might actually take children's mental health back into the mental health system because they dumped it on a DCYF, and it got absorbed into a system that's fundamentally juvenile justice, which has nothing to do with juvenile. Well, it has. I shouldn't say that. It has something to do with juvenile mental health, but there's plenty of juveniles with emotional disturbances who are not truant and not criminal, and they got just sort of absorbed in that. So they got less resources.